So we're gonna go ahead and pick up where we left off. We're gonna go ahead and palpate the patient's thyroid from the back. I'm gonna push over to the left and swallow. Okay, I'm gonna push over to the right and swallow. Okay. I'm gonna go ahead and inspect the back. I'm gonna have you to turn around just a little bit for me. All right. Patient's skin is appropriate for ethnicity. Patient's skin is warm to touch. He has like 2 mosquito bites on the left side of his shoulder. We're gonna go ahead and check for chest expansion. Can I have you to breathe in and breathe out? Okay. And now we're gonna feel for crepitus. Let me know if you have any pain or any tenderness, okay? Any pain or tenderness?
No.
All right. Now we're gonna check for tactile firmness. I'm gonna have you say 99.
99. 99. 99.
Okay. Now we're gonna also check for CVA tenderness. Let me know if this hurts, okay? Does that hurt?
No.
What about that side?
No.
All right. We're now going to go ahead and percuss the back side. Relax for me. Not sure if you can hear that. Okay. All right. Now we're going to oscillate. But before I oscillate, while percussing, it went from resonant sounds to dull sounds. So now we're going to oscillate the lung fields. I'm going to have you to breathe in and breathe out each time I move the stethoscope, okay? Breathe in, breathe out. Okay, patient's lungs are clear bilaterally. We're gonna go ahead and turn back to the front, and I'm gonna inspect the front as well, okay? Okay, so patient's skin is appropriate for ethnicity. We're also gonna check for turgor while I'm here. There's no tinting, so patient does not show signs of dehydration. We're gonna go ahead and inspect the skin. As I stated before, patient's skin is appropriate for ethnicity. Patient's skin is warm to touch. No types of lesions present on the skin. We're gonna go ahead and check for chest expansion. Go ahead and breathe in and breathe out. Okay. Now we're gonna go ahead and feel for crepitus. Put your arms down. Does that hurt? Does that hurt?
No.
Okay. And now we're going to go ahead and check for tactile firmness. Could I have you say 99?
99. 99. 99.
Okay. We're now going to oscillate lung sounds. Okay. Breathe in, breathe out each time I move. Okay, patient's lung sounds are clear bilaterally. We're gonna go ahead and go on to the cardiac assessment at this time. We're gonna have you to get up and we're gonna go to the couch, okay? In a normal setting, we would either have a hospital bed or we would have be in an examination room where we would have like a table, but we don't. So we're gonna compromise at this time. Sorry for moving the camera around. Okay. So in a normal setting, he wouldn't have a pillow behind his head, and he would be at a 40 or 45-degree angle checking for JVD. In this case, we're going to compromise with the pillow as it does set him up to be almost at like a 40-degree angle. So I'm going to grab my ruler, centimeter side, arms down for me to your side. And we're going to find the angle of Louis. Turn your neck to the, there we go. And patient's JVD is less than 1 centimeter. So patient is negative for JVD. We're going to go ahead and inspect for lifts or heaves. Arms to your side for me. Not showing any lifts or heaves present in the patient. Now we're going to, palpate the mid-sternum water, the base of the heart, and the apex of the heart. Any tenderness?
No.
Okay. Patient's PMI will be considered 5th intercostal space down and mid-clavicular. I actually feel his pulse. Okay. We're going to go ahead and percuss now for resonant sounds. We're going to start on the left side. Move your hands so they can see. Put your hands down. I don't know if you can see that, but okay. Any pain when I did that?
No.
All right. Now we're going to oscillate. Had to grab my stethoscope. I apologize. So we're going to go 2nd intercostal space to the right, aortic. 2nd intercostal space to the left, pulmonic. 3rd intercostal space to the left, Erb's point. 4th intercostal space to the left, tricuspid. S1 and S2 sounds are present, by the way. 5th intercostal space, mid-clavicular line, mitral valve, S1, S2 heard. Okay. Now we're going to go ahead and listen for 1 full minute at the PMI using the bell portion of the stethoscope. So 5th intercostal space down, mid-clavicular. Got like 30 seconds left. Seconds left. It's the longest minute ever. I'm sorry, guys. Patient's PMI was 64. Upon listening for 1 full minute, I'm going to go ahead and have you sit up a little bit so they can see a little bit better. So scoot up for me. Okay. Right now, I'm going to go ahead and oscillate or inspect first the patient's abdomen. You gotta move your arm. Patient's abdomen is flat. Skin is appropriate for ethnicity. And upon that, we're going to go ahead and oscillate. Okay. So As we're oscillating, we're gonna go. This is the right side. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. And we do have active vowel sounds ×4. So we're going to go ahead and name the parts of the abdomen. So in the right lower quadrant, we have the cecum. The right upper quadrant, we have the liver. The left upper quadrant, we have the spleen. Left lower quadrant, we have the descending colon. We're going to go ahead now and also take the cardiac. So we have the aorta. We have the right renal. We have the left renal. We have the left iliac. And we have the right iliac. And if we were to go further down, we would have the right femoral and the left femoral. We're going to go ahead and go down to the legs. Scoop all the way up in the, use the pillow. See if we can move the pillow. Sit back. Okay. I'm not sure if you guys can see his legs, but I am going to sit down for a second. So I don't have anybody to hold my camera, but I would touch both legs, feeling for temperature, which I'm going to do. Patient's temperature is warm bilaterally. We're going to go ahead and test for edema. No edema bilaterally. Just to show. Okay. Now we're going to go ahead and check the patient's pedal pulse, which is in his feet. Camera to fall. No. Just hold your legs up. Give me 1 second. We're going to try and compromise. Legs up. I apologize. So we're going to check for pedal pulses. Okay. Okay. Now we're going to check the patient's toes for crepitus, any swelling, any type of bruises or redness, any pain as I'm checking. Yeah. Okay. Okay. Push against my hand. Plantar flexion. Pull against my hand. Dorsiflexion. Could I have you to curl your toes? That's flexion. Bring them out. Extension. Bring them back. Hyperextend. Spread your toes for me. Abduction. Bring them together. Adduction. Do me a favor and rotate your ankles for me. Okay. Now we're going to go ahead and have you to remove this pillow. We're gonna move back to our normal position. Sorry, guys. we're gonna do range of motion. We're also gonna check for deep tendon reflex. I'm gonna have you to sit in the chair for me. Actually gonna bring this down to the floor for a second. Sorry guys. 1 second. Okay. So we're gonna check the deep tendon reflexes on the patella. Come on, go like this. His feet are not dangling, so I don't know if it's gonna work, but in a normal setting, his feet will be dangling, and you would hit in between the tendon. Okay, I'm gonna try the other side. Okay, and we're gonna try the Achilles tendon. Okay. Patient's reflexes were fine. I'm gonna go ahead and sanitize my hands. We'll bring the camera back up. And we're gonna check the tricep tendon on each side. And the bicep on each side. Okay. Okay. Now we're going to go ahead and finish up with range of motion. For elbows, we're going to do flexion, extension, hyperextend. And don't let me push you and don't let me pull you. So bring your arms up like this. Don't let me push you. Don't let me pull you. Okay. Now we're going to go ahead and do the spine. I'm going to have you to stand up. Go ahead and bend over. Touch your toes. Touch your toes. Flexion. We're going to check his spine. Spine is in line. Stand up straight for me. That's extension. Bring your leg back. That's hyperextend. And we're going to go ahead and do lateral flexion, which is side to side. Okay. We're going to move right along. Rotation like hula hoop. Can you do that? All right. Now we're going to do range of motion of the hip. We're going to bring one leg up for flexion, down for extension. And for the hip, I believe you step forward for hyperextend. Okay. Now we're gonna AB duck by step into the side. Step to the side for me. And bring it back in as AD duck. Okay. And now the other leg we're gonna bring up. Come on. Did you do that leg already? Okay, so flexion, extension, back for hyperextend. Okay, bring it back up. Step out for abduction. Bring it in for adduction. Okay, and I'm gonna test your strength on both sides. Step out for me. Don't let me push you. Step in. Don't let me pull you. Okay, step out for me. Bring that leg back in. Step out for me. And step in for me. Patient strength is 5 out of 5. We're gonna go ahead and go to the knees. Bend your knee for flexion, extend for hyperextension, and we're gonna step forward. I think that's so backwards. Now with the other leg, flexion, extend, and then forward for hyperextend. Okay? Now we're gonna go ahead and assess your gait. I'm gonna have you to step back for me. For your gait, I'm gonna have you to walk forward for me. Now you're gonna tiptoe to me. Walk on your heels to me. And one more time because they didn't see it. Tiptoe. Now walk to me, heel toe. Heel toe. All right, and that concludes my head to toe assessment. Thank you.